Traffic is forced off there after a major overnight wreck. And this involving construction workers struck by a vehicle. Traffic is backed up to State Road 149. There's a huge jam there, and then the traffic is diverted off at 20. Avoid the area if possible. There was an earlier crash west of Michigan City on 94 on the Indiana Toll Road westbound before 421. That has now cleared entirely. Looking at the Veterans Memorial Tollway southbound 355 at Boughton Road. There's a truck fire report there. It's traffic. I'm Jim Talamonte on AM 560 The Answer.
More of Chicago's Morning Answer comes your way next. Now your official Chicagoland weather forecast. We're going to see some fog burning off this morning, then a sprinkle this afternoon going up to 72 degrees. Clouds roll in overnight for a low of 56. Then tomorrow it'll be mostly cloudy, pretty warm, maybe a shower or thunderstorm in the afternoon. We'll be going up to 79 degrees. Your next news update in 30 minutes. For continuous coverage of the latest news, traffic, and weather, go to 560theanswer.com. I'm Elisa Z. Now more of Chicago's Morning Answer on WIND, AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. Let freedom ring this afternoon at 2 with Sean Hannity on AM 560, The Answer.
Top of the morning, Dan, and in for Amy this morning is Sean from Elmwood Park. This debate over excess deaths continues to rage on in terms of looking year over year at deaths that are brought on by various maladies and trying to quantify whether or not we are more likely undercounting COVID-19 deaths or more likely overcounting them. This is a debate going on in academia right now. The way we're counting COVID-19 deaths has been presented transparently. You can't argue that. Dr. Birx presented it at the national level. Here in Illinois, Dr. Zike, the public health director for the state, also said essentially what Dr. Birx said. Look, if you have COVID-19 and you die for any reason, effectively, that's a COVID-19 death.
Be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that was the cause of the death, but they had COVID at the time of death. I hope.
Well, I mean, so they've set it out straight away. So you can't say they're misdirecting or they're giving you a false impression of how they're counting the deaths. There is no distinction between dying with or dying from. It's all dying from for statistical purposes. So what's the issue with that? To answer that question, we're pleased to be joined by John Lott Jr., president of the Crime Prevention Research Center, author of The War on Guns and More Guns, Less Crime. John, thanks for joining us. Appreciate it.
Well, good to talk to you.
Well, so to my question, you heard what Dr. Zike said. Dr. Birx said something similar to that in terms of the national count. So what's the problem? We understand how they're classifying these deaths, and so we should take that into account when we look at the numbers.
Right. Well, that's not the only issues that you have. I mean, those are significant by itself, and as you say, it's across the country that they're doing it. But take New York, for example. A third of the deaths that are classified as coronavirus deaths, when they've done the post-mortem tests, which they do on all the bodies in New York, a third of those people that they classify as coronavirus deaths tested negative on the test. They were classified as coronavirus deaths simply because they had symptoms that were similar to what you would have with the coronavirus, but it could have been the seasonal flu. 85% of the people who have the coronavirus are asymptomatic. The vast majority of the remaining 15% have essentially flu-like symptoms. You're only talking about a few percent which actually have any type of really serious symptoms beyond what you would see with the normal flu. So, you have a third of the cases in New York, probably more than a third of the cases in New Jersey, which are being classified that way. Those are pretty large numbers. But on top of that, one of the other things that Deborah Birx has said is that as much as 25% of these cases, with this broad definition to begin with, are being double counted. So if you have a third of the cases, let's say in New York, which probably shouldn't be included, or the vast majority of them shouldn't be included, and then you have these other issues that you raised to begin with, that any death, even if it's a suicide or somebody dying in a car accident or somebody dying from a heart attack, even though they're asymptomatic, so it's completely unrelated. And as I say, 85% of the people with the virus are asymptomatic. You're adding another 25% on that simply because of errors in how the CDC is counting this. And of course, today it just came out, or yesterday it just came out, that the CDC has acknowledged it's made another error, and that is when it's been putting out the number of new cases every day, what they've actually been doing is the number of new cases and the number of people who have positive for the antibody test that's there. So what may be also happening on top of that is that even if you have an antibody, which means you may have had the virus at some point in the past and you die, that may also be being counted.
Yeah, there's a couple of things there I just want to underscore. I think that's an excellent point you make about the testing, and if it looks like it's COVID-19, then we're going to classify it as COVID-19. You may have been able to make that case in March when testing was an issue, testing capacity was an issue, but that's not an issue now, and so there's no reason not to be able to test and to confirm. So that's an excellent point. You're also right about Dr. Birx. Remember, it was just about a week and a half ago, she was quoted as saying by the Washington Post that there's nothing from the CDC that I can trust. I mean, that is a staggering indictment of somebody in her position of the CDC. And the double counting issue that you raise is another legitimate one in point of, and then the third one too, I just want to summarize so we understand where some of the causes, one of the source of some of these potential inaccuracies, the sources are. Dr. Ezike here in Illinois has said the same thing about data entry errors, and that's what you're talking too about. Whatever how it's being recorded, there's errors being made, human errors or errors in terms of the algorithms being used, depending on how they're assessing all of this data. But she's conceded that point too. There's always going to be human errors with this, and so on and so forth. So, boy, those are three big buckets of potential error when you look at count. And why is that important? Not because we want to sort of dehumanize or minimize the amount of suffering and death, but because big public policy decisions are being based largely on this number.
Right. Look, if 65 or 60% or so of these deaths are kind of false cases, you're still going to end up with 40,000 deaths that are there. And 40,000 deaths is a lot of deaths. There's no way around it.
Right.
And it's important. But you still need to put that in perspective. Over the last decade, the worst flu year that we had, there was a little bit over 60,000 deaths from the seasonal flu that we've had. If you look over time within my lifetime, the 1968-69 flu season, you had well over 100,000 flu deaths in the United States. That's with a much smaller population in the U.S. than we have now. So the rate was much higher. I don't remember schools closing down and other things, but the important thing is, as you say, a lot of policy decisions are being made now based upon these numbers. And there's a big difference between saying it's 90-some thousand and 40,000. Both are big numbers, but people have to have some type of perspective. And the other thing that concerns me is that a lot of people are dying or going to die because of the shutdown. So you have, they use terms like elective surgery. I don't think people understand what elective surgery means. Elective surgery means any surgery that's scheduled. So if you have somebody who has cancer and they're going to go in for cancer surgery and that's scheduled, that's surgery that's been put off because of people like your governor and others, which have essentially closed down the hospitals to elective surgery. Well, what's going to happen if you make people have to wait 2 months or 3 months for cancer surgery? What does that do to their survival rates that are there? You have so many other people who aren't going to hospitals because of fear about the virus. If you have somebody who has heart issues or a stroke, time is essential for making sure that people are properly treated. There are lots of stories where people have had, burst appendixes and have died because they're not going to the hospital because they're concerned about getting the disease. And so, these types of, when we're trying to make a decision here, what we really need to figure out is how many people have died from the shutdown. You also have suicides and stress-related illnesses as jobs are lost and as businesses are being destroyed. You mentioned excess deaths, which is a number that's constantly being mentioned in the media. And there's been a huge increase in deaths over and above the normal rate of deaths, let's say last year or the year before. It's about 30% higher. But to attribute those directly to the virus is a huge mistake because not everything else is the same as it was in past years. You have all these people who aren't going to the doctors or are getting treatment being delayed. And so that's the reason why yesterday you had a large number of doctors sign a letter saying that they were concerned that there was a ticking time bomb of mass deaths that were going to be occurring because of the governors who have shut down the healthcare system in the country for many types of cases that people have issues with.
So, John, I'm familiar with you from years ago, your book, Freedomnomics, which I thought was fantastic. I know you're an economist, and you're very familiar with selective data to support a hypothesis. Given the fact of how magnificently wrong all of the charts and all of the predictions and all of the politicians were and are, and even with the cooked numbers in comparison to the predictions, the actual death rate is infinitesimal in a country with 330 plus million people. Don't they have to lie to us? Isn't it for our great good for that we understand, even though this was a massive failure, an extreme overreaction, and a usurpation of our rights, don't they have to cook the books to get us to go along with it?
Look, I try not to get into what's going on in people's minds. It's hard enough just to try to figure out what's going on with numbers. And that's basically what I deal with in all my career on a lot of different topics, is just trying to get the numbers right. And I've been working with Tim Allen, who's he's a governor for the American College of Pathology. And, the errors in these numbers, whatever the motivation, are huge. If a difference between 40,000 and 90-some thousand, those are big differences that are there. And there are other issues with the numbers we haven't even talked about. So one of the things you find doctors around the country here are complaining that they're getting pressured to list deaths as coronavirus deaths, even when they don't believe that's the case. And that hasn't been true for other illnesses, they say, like the flu, because hospitals and doctors get paid 20% more by the federal government if it's a coronavirus case than if it's listed as the flu or something else. And
there's something else too I just wanted to comment on. That's another good point you make, but it's almost like we've never had anything like this before, except we have. The response is unprecedented. The outbreak an outbreak like this, plus all the complications in terms of responding to an outbreak like this, not new. And all you have to do is go back to H1N1. 4 years after H1N1 had subsided, the end of the last decade, there was a study done by a bunch of epidemiologists, 4 years removed, trying to assess how accurate was the counting of deaths and other metrics with respect to H1N1. And they looked at more than 6 dozen studies that were done sort of within a year of the outbreak to the conclusion of the outbreak. And they varied from lethality rates, projections of 1 in 100,000 to 10,000 in 100,000. They were still debating what the lethality was of H1N1 4 years after it was a distant memory. And so I suppose we shouldn't be surprised that we're having these debates right now about the accuracy, not just of models, but of the data collection.
Right. Look, I mean, there have been huge costs to this. My own fear is that we're going to look back on this. And while it's understandable that people wanted to be careful on this, that the damage that's being done to the economy, the damage that's being done to people's wealth and incomes, the huge, massive increase in debt now that's well above 100% of GDP, is going to have ramifications for generations. And, these governors, whether it be your governor or, Michigan's governor or New York or other ones, which are, keeping the economies in these places locked down, there are going to be real consequences. I'm concerned that just the increased the reduced income, poverty, those things are related to health in the long run for people. Those things are related to things like suicide rates, and we're not seeing a balance in terms of the cost and benefit discussions of the different types of rules that are being put in place. I'll make one last point, and that is, these people that are putting out these estimates, as you say, which have been wildly wrong, both of you, these are public health people. I have to tell you, I've had to deal a lot with public health people on the gun control debate. Amazingly enough, while you have criminologists and economists that deal a lot with crime, and you would think criminologists and stuff should be getting most of the money from the government dealing with gun control type issues, over 90% of the money, about 94% of the money that the federal government gives out to study gun control issues goes to these same public health people that are providing these predictions and these estimates on what's happening with the coronavirus. Mm-hmm. And I don't think they're any more accurate or useful in going and studying gun control than they've been in doing this. But if you look between 2015 and 2018, the federal government alone gave out over $43 million to go and study gun control issues, and 94% of that went to public health people. I don't even know how you spend that much money that they do on these studies.
Well,
but just so people know, the vast majority of pro-gun control research, and that's the reason why they give it to the public health people, because unlike criminologists and economists who are very skeptical of gun control, the public health people are, crazy in favor of gun control generally. They're the ones who are getting massive amounts of money, and their statistics, I have to tell you, are scary because they're like 30, 40 years out of date compared to other academic professions. And you see that just in terms of the huge errors that they make in terms of these predictions for the coronavirus.
He is John Lott Jr., president of the Crime Prevention Research Center, author of The War on Guns, More Guns, Less Crime, as well as Freedomnomics, as was mentioned. John, thanks for joining us again. Appreciate it.
Oh, thank you.
And he joined us on the Turnkey.pro answer line.
Before you see it on TV, share it on Facebook, or read about it in the paper, hear it here first. This is Chicago's Morning Answer on AM 560. The Answer.
I'm doing it right now, taking my Balance of Nature, 6 capsules of Balance of Nature. You're getting 10 servings of 31 different fruits and veggies. Why am I doing it? Well, I want a strong, healthy immune system, and I want